So let me go ahead and get started. I have several people who are helping behind the scenes. If you have questions during the presentation and during the discussion, please drop them in the chat. We do keep people muted during the event, but ask your questions in the chat, and they will collect them and throw them in as either at the end or if they seem relevant during the discussion. So thank you all so much for joining. This is an event that we have worked very hard to put together. I so appreciate the group of people who are joining us this evening to talk about vaccines and public health, such an incredibly important issue, and one, as I keep saying, that we really don't know what we can do. And so hopefully we'll equip you with some information and also some tools to help you understand where you can do something. You can raise your voice. So first of all, let me introduce Ashley Chambers, who is with Arizona Families for Vaccines, and Amy Bernard, and also our other guest, Stephanie. Stephanie James. I'm so sorry. I'm terrible with names. And let's just start by having you introduce yourselves. Ashley, why don't you start?
Sure. Hey, everybody. I'm Ashley Chambers. Like Kathy said, I live here in Arizona. I'm the director of Arizona Families for Vaccines. Arizona Families for Vaccines is a state chapter. We're one of 11, and we're part of a national nonprofit called Safe Communities Coalition. Although our name, as of tomorrow, will be changing to American Families for Vaccines. Like I said, we have 11 state chapters, and we're moving into three additional states this year. All of our state chapters are in all sorts of political spectrum states, red to blue to purple. But we have one lane, and that is pro vaccine policy. We don't do anything else besides pro vaccine policy. So that's our focus. And we are the only pro vaccine advocacy nonprofit out there. A little bit about myself. I was a litigator in Arizona for over 10 years. And one knew I wanted to get into policy, so I switched and I started getting into policy for the area of law that I practiced, and I represented the attorneys at a nonprofit of that area of law at the legislature. And then I heard about Safe Communities wanting to establish a Families for Vaccines chapter in Arizona, and we have been doing this for 2 sessions now. So thank you for having me, Kathy.
Hmm. Yeah. Amy, how about you next?
Sure. So, first off, thanks for having me. I always appreciate the opportunity to talk about vaccines and immunology, and also how to be a pro science, pro vaccine advocate. So, I am an immunologist, PhD immunologist, and what I focus on, I'm in Denver, Colorado. And we have a safe community. That's how we met Ashley, is we're part of a safe communities here in Colorado for pro-vaccine. I'm a volunteer unpaid board member for Immunize Colorado. And you'll meet Stephanie here in a minute. She's the president or the chair of our board. And I am a professor on the Anschutz Medical Campus, and I specialize in teaching medical students and PA students and graduate students all about the immune system as well as vaccines. In my spare time, I also advocate for pro-vaccine and pro-science policy, and I've done that with Stephanie also here in Colorado. Um, I do a lot of science communication. I work with faculty to talk about their science in understandable ways. So I translate from science to English. That's one of the things I do. And then personally, I hike, bike, run, kickbox, black belt in Taekwondo, and my twins just turned 21.
Oh,
So let's just say that I have been going to bars more frequently than I have in a very long time because they would like someone to drive them. So that's been kind of fun. So anyways, with that, I'll pass it to Dr. James.
Hi, everyone. Well, again, I echo Amy's thanks for this invitation to come and be with y'all tonight. So my name is Stephanie James. I'm also a PhD, and I serve as the Associate Dean at Regis University in the College of Health Professions, where I'm also a professor of pharmaceutical science in the School of Pharmacy. So I still get to have my hand in teaching, and some laboratory activities, as well as the administrative side. Like Amy said, I'm very much a pro-vaccine advocate. I'm a former public policy fellow with the American Association of Immunologists, and Amy and I are both on their public communications committee now. And so really enjoy getting out, working with the public. I love Amy's phrase of translating, science to English. I think, I would echo that I also try to do that as well, especially for my students that are going to become clinicians one day. Yeah, I think like Amy, I like to do all things quote unquote Colorado. So hiking, fishing, biking, all of, try and be outside as much as we can in the beautiful Rocky Mountains. But I do have my future son-in-law is in Tucson. And so I try to visit there when I can. So thank you all.
Fantastic. Thank you all so much. We're so fortunate to have you with us this evening. So, one of the first things I want to do, I always like to start out with the big picture. So can you, and maybe why don't we start with Stephanie? I want to sort of place vaccines in the overall public health sort of picture. So, how is vaccination sort of a function of good governing? And I mean, overall, what is public health and how do vaccines fit within that context?
Yeah, great question. And Amy, feel free to jump in as well, or Ashley. I public health is really, how your population's health is, right? It's a population health. So instead of looking at how you and your individual health is, what is the health status of your entire community? And what measures are occurring, in terms of policy to promote good health practices, whether that is, from exercise and eating right, to brushing your teeth, to vaccinating yourself and your family. They're all measures that are really focused upon what is in the best interest of the population. And so that's more of what public health is and population health. I think those two kind of, go together a lot.
Yeah, I'll jump in really quickly. When I think about vaccines in the context of public health, just like Stephanie said, we think of ourselves as a interconnected community of humans that are trying to keep each other healthy. And the best way to do that, to prevent infectious disease and to keep things from spreading, is vaccination. And while vaccination or immunization protects me, it also protects people in my community, like babies that are too young for, like, say, the measles vaccine, the MMR, or patients who are undergoing chemotherapy and have weakened immune systems, or people with immunocompromised or immunodeficiencies, people who have had transplants, who are on immunosuppressives for life, and because of that, their immune systems don't work as well. So there's nowhere in this world that you wouldn't interact with at least some people that have some type of problems with immune systems that would need your protection. They need you to get that immunization and act as a shield for them. So to me, it's all about protecting yourself, but also protecting your community. And like Stephanie said, doing all of the things that you can to keep yourself healthy in your community. And I think immunization is one of the key factors. And I saw that there's a question in the chat from, looks like Ann Hart. Why and how has vaccination become a bad thing? I don't think it has become a bad thing. I think people think it is a bad thing. It is not. We forget because we're starting to see infectious diseases come back that actually cause serious harm and death. But we've been fortunate because vaccines work, we don't see these things as frequently. So I think that vaccines are a victim of their own success, and we've done so well, and now people are taking that success for granted because they haven't seen those things. So that to me is very sad because that means that there will be people, kids, elderly, even healthy people can die from the flu or measles, so it just makes me sad. I'd say it's heartbreaking.
Yeah, I agree. And I think that one of the issues is when you prevent something, you're being asked to sort of appreciate something that doesn't happen, and that is really hard for the human mind to grasp, apparently. So let me turn to Ashley. So public health seems to have run into some conflict with individual freedom, or how some people see their individual freedom. How do you sort of tease that out in terms of, you're dealing with community health, and we interact with other people. We are in a society, we are in a social structure. So how does personal freedom, and that is how a lot of people think of vaccines, you're invading my body with something that I don't seem to understand. How do you deal with that? I mean, it's just hard.
Yeah, it's such an interesting point. But I always like to start with like a grounding in that anti-vaccine activists have been around for a very long time. Like as long as vaccines were around, there have always been people who don't believe in them and who don't want to take them. They were typically of the vein that my body is my temple. I don't want to put anything into it that I don't know what it is. I want to know the farmer. I want to have the word organic in front of whatever I put into my body. Since COVID, we have seen the anti-vaccine movement grow and sort of explode in popularity. And it's morphed into this two-headed beast where you still have those people who typically will align with left-leaning policies, but still believe this, my body is my temple. And there is this new cohort that are very anti-government authority, anti-regulation, anti-establishment, and that is taking the shape of anti-establishment on science and on vaccines. And so these two very seemingly opposite people who don't have anything to agree on, they would never sit down to dinner together, let's just say that. But like they completely align on this very slim anti-vaccine stance. So it's very odd when you think about that so far left and so far right have gone so far that they're meeting at a point where, and on this one issue. So I think that's sort of like laying the ground of what we're dealing with when we talk about people who are anti-science and anti-vaccine in general. And I think it's totally fair to say that you value personal freedom. Nobody likes being told what to do, right? Nobody likes being thought that they don't have a choice. But I think that this friction between personal freedom and public health is misplaced because at the core of it, people don't really understand that your decision to vaccinate or not vaccinate has ripple effects on everybody else around you. I can't tell you how many times I hear, well, actually, if you're scared of those diseases, you can vaccinate, but my choice has nothing to do with yours, which is, it's a fundamental misunderstanding of vaccination and how it works. Because the more that people are vaccinated, the more that there is herd immunity and there is a less recurrence of disease. That is just fundamentally how it works. And so when people say, my choice has nothing to do with you, it shows that they don't understand that because of my choices, the disease risk for babies and infants is low. The disease risk for cancer patients is low. The disease risk for people on immunosuppressants because they have transplants is low. So I think that's like the real problem when people are saying there's that friction there. It's just a fundamental misunderstanding of what vaccines do.
And I would also add too, there is many people, I think they choose to follow guidance and belief systems of what they are most attached to. So I'm noticing some stories in the chat of, well, my father, was on a ship and everyone had polio. And so we're very grateful that he was able to receive this vaccine. So it's something that you have a story to relate to. And a lot of people don't have that story to relate to anymore. And now there is so much more of an influx of misinformation and a very welcoming community of, if you're unsure about vaccines, they, are really willing to kind of bring you and envelop you into their community. And so then you have that attachment. So a lot of it too is based on, your own personal stories and where your attachments are. And it kind of goes back also to vaccines are a victim of their success, because people are having fewer and fewer of those personal stories because we don't see polio and measles and rubella and diphtheria like we used to, right? So some of those stories are getting lost. And so it's easier, I think, for people to be swayed that vaccines are not safe and they're dangerous.
I also think that a lot of people, and this may be a little bit off, it's not off topic, but I think a lot of people don't understand that vaccines are harmless forms of the pathogen. So harmless. They've been tested rigorously for safety and efficacy, and they work with your immune system. So they train your immune system. Like the cells of our immune system actively train. It's like, for me, for Taekwondo, I trained for, 5 years to get 6 years to get my black belt, right? With my kids, by the way. We keep my husband safe. um, so you train for years. You train how to fight your enemy, like for tournaments. You remember that training when you go into battle or into a tournament against that infectious agent. You remember how they fight, and then you succeed, you win. So you train. The vaccines work with your immune system to train the cells of your immune system to know how to fight, to remember that fight. And then if the infectious agent comes in, the real thing, you fight it off often before you ever even know that you've been infected. So, I mean, it's just this amazing thing that we have learned how to harness or use our own immune system. I've even seen in some of the anti-vaccine chat groups, a couple people will pose, wouldn't it be great if we could just give ourselves like a little bit of the pathogen? And I was like, oh, that is what we do. Thank you for inventing vaccines.
And I think what's also really key, what Amy says, and I know we both teach this, is that vaccines work with our immune system. I think a lot of people think it's some sort of assault on our immune system. And I think it's really important to change that mindset into individuals that, this is sort of this beautiful, perfect medicine where you don't have to take it every day, like a statin to control your cholesterol. This is something you can have a few doses of, and it teaches your body what to do. And so I always, I'm trying to remind people this is working with our immune system to provide protection.
Okay,
I think
well,
that's important.
let's hope that we can make some headway in that issue. It is really challenging, and I'm always thinking, how does the human mind work? This is very strange. So let's sort of dig in and get a little more specific on, particularly in terms of what's going on with the Department of Health and Human Services, and I mean, the elephant in the room, RFK Jr., who is now in charge of that huge department. Is he qualified to lead HHS? What, Stephanie and Amy, what do you think? What are the qualifications to be in charge of our
Yeah.
entire public health system?
You know, I think when you go back to, it's important, you know, to put the political drama aside and say, you know, what is the role of someone leading a health and human services organization, and what does that organization do? And we know that this organization is charged with, you know, a huge amount of things, you know, from, you know, NIH grant funding, provisions in that to, you know, CMS and Medicaid, Medicare, and what benefits are offered there, as well as promoting public health programs. And so when you think about how detailed and involved this government agency is in healthcare, I think you really want someone then that's leading that organization to have a lot of experience in healthcare, maybe leading, you know, the Medicare, Medicaid programs at a state level, or, you know, be a physician that's worked, you know, really well with, you know, preventive medicine and so forth, and really have this rich experience of healthcare and insurance and how you're paying for healthcare. And so when you look at what those requirements are, and then you look at the qualifications then of Mr. Kennedy, he doesn't, in my mind, meet those qualifications because he's never been a physician. He's never, you know, been a nurse or, you know, a pharmacist or a healthcare provider. He's never worked in a Medicaid, Medicare facility or program. He's never worked off of grant-funded, federally funded research programs. So for me, politics aside, he's not qualified simply because he doesn't have the background.
If you look
Put
at the
put
actual
aside everything else.
qualifications, yeah. If you look at the actual qualifications, though, I mean, not trying to be like the devil's advocate,
Yeah.
but because he is a lawyer, there's nothing to say that they have to have healthcare experience or be an MD or a nurse. But I completely agree with you. That is kind of a loophole.
Yeah.
And that should actually be a qualification. But I was looking up, you know, they have to have advanced education. So a law degree is actually, a JD is considered to be fine. They should have extensive experience with government agencies and policy and healthcare administration. I would say, you know, probably loosely, if not very well for that. Leadership and management skills, he probably does have leadership skills. Although we may not agree with the people he's leading now. But the one of the former secretaries was a woman who was a governor of Kansas and had a Master of Public Administration degree, and she did a good job. So, I mean, I think it just also depends on the person. So, on paper, is he qualified? On paper, potentially, but so is my crazy uncle. Would I want? You know what I mean? So I think we have depended upon nominees being ethical, you know, having the same morals as far as upholding the healthcare system and things. So I feel like on paper, yes, but in practice, no. So I don't know.
Yeah, I know it's terrifying, frankly.
Yeah.
Um,
Yeah.
so, what are some of the impacts that he's been having and uh, that are coming down to us in the form of policies? And of course, you know, the ACIP board is particularly concerning, but I mean, I'll just ask it as a general question. What are some of the things, changes that he is implementing that are affecting us either already or impending?
Oh my. Well, I'd say he's the cause of like a headache every day
Yeah.
for an immunologist and vaccine advocate. I'll start with the ACIP and then I'll pass the baton to Stephanie. But the Advisory Committee for Immunization Practices typically is medical professionals, MDs, so physicians, people that have experience with vaccine development, design, implementation, people who give vaccines, people who do vaccine research, clinical trials, safety and efficacy. And what he did was he went in just overnight and released 17 highly vetted, very, I mean, expert individuals that are from across the country, like 17 incredible, dedicated public health servants who have dedicated their lives to vaccines, and they were just dismissed for no reason other than he wanted to replace them with seven, or I think it was eight, but I think now we're down to seven people who are not they're not qualified in the same way. These are people who are declared vaccine skeptics. These are people that have spoken publicly against vaccines during COVID. These are people that have published fraudulent and retracted papers that vaccines cause autism. I mean, these are horrific. These are not the experts that should be on this committee. Now, some of them do have advanced degrees. So, again, on paper, they're qualified, but when you look at in practice and how they behave, they are not. And he just, dismissing an entire 17, usually they also go staggered. You would have like two of them would time out and then two new ones. So you'd have experience, you'd have, a succession plan for experience. We know that that's really important. Um, that blew up, having the ACIP disband, and then I think Ashley would probably know this plays a role on the VFC, the Vaccines for Children, and how that plays a role in insurance for kids that need vaccines covered by insurance. So I'll stop talking. I'll pass the baton to Stephanie and Ashley, but let's just say daily headaches.
Yeah, and I don't know if Ashley, if you wanted to elaborate on that first.
No, go ahead, Stephanie. Talk about the Medicaid and who doesn't love insurance talk?
Yeah, there has been a lot of insurance talk, especially with the new legislation that has been passed. What is that going to look like for particularly low income individuals that rely on government funded health insurance programs such as Medicaid for relevant to this conversation, their immunizations. And so, I there's a couple caveats with this. One is, that changes to Medicaid is not going to occur immediately. It's not set to go into effect, soon. I think it's going to be another year before we see those changes, but it's going to be much more difficult for individuals to obtain and utilize Medicaid and Medicaid services. And so that means that those individuals will not be receiving their immunizations, and a host of other really important pieces of healthcare. And so you're going to, the fear is that you're going to decrease the number of people that are being immunized, and you're going to increase disease rates. And I would argue that that is going to cost much more than it would be then to just continue to fund Medicaid at the levels that it is now. I've worked on the Hill in DC a lot, and they always said if you really wanted to get rid of the deficit, you would actually cure Alzheimer's disease, right? So cure Alzheimer's, cure dementia, because the costs associated with that care are huge, and play a huge role in the healthcare burden costs in the United States. And so, the VFC Vaccines for Children program is run through Medicaid. And so states will receive an allotment of funds for vaccines. And these vaccines that they receive funding for is dependent upon the CDC immunization schedule, which is also in part decided by that ACIP. So if the ACIP comes back and they said, you know what, kids don't really need the MMR vaccine, we're going to take it off the schedule, that means that VFC won't pay for those, right? And so you're going to see, you know, in the case of measles, I would predict a real explosion in, you know, the measles outbreaks compared to what we're seeing now, because we're going to have a severely pockets that are under vaccinated. So this is a big deal. But the way that they are phasing it in, you know, you might not see the outcomes of this until another president is in the White House even.
Yeah.
And that's also, I think, you know, in terms of policy, people have short memories. And so that's also very frightening.
Mhm.
Yeah.
Yeah. One other thing that I want to make sure I mention is it's been getting some news hits. Also, there's another piece of um, you know, the ASIP and then the vaccines for children, which is like the free vaccination program that a lot of kiddos in Arizona get their vaccines from, is the vaccine injury compensation program that is also tied to ASIP. There's a lot of propaganda out there that demonizes pharmaceutical companies, and I'm not saying that pharmaceutical companies are perfect. I don't think any corporation is perfect. I don't think any nonprofit is perfect.
Yeah.
But the vaccine injury compensation program was created in the 80s because what was happening was there were lawsuits being filed, and anybody in America can file a lawsuit against anybody, right? That's just the society that we live in. There were lots of lawsuits being filed against vaccine manufacturers, and many of them had no validity whatsoever. But yet, pharmaceutical companies have to come in and defend every single lawsuit that is filed against them. Just like if your neighbor was sued, they would still have to come to court and defend that claim. But that doesn't mean that your neighbor did anything wrong.
Yeah.
So it was costing a lot of money for pharmaceutical companies to come in and to defend against a lot of these meritless claims. And because of that, vaccine manufacturers were like, our profit margins on vaccines are very small and we are losing money. So we are either going to have to raise prices on vaccines, or we're going to have to stop distributing our vaccines in the United States. And so Congress saying, whoa, 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 that would be, you know, really, really terrible for the American public, was like, we need to come up with a system that vets vaccine injuries. So when in the very, very, very rare scenario someone does have a true vaccine injury, there's a way that they can easily go and get compensated for it that doesn't put the supply chain at risk. So that's how they came up with the vaccine injury compensation program. All those vaccines that are recommended by ACIP have coverage under this vaccine injury compensation program. So that's how you get compensated. Once anybody removes a vaccine from that ACIP recommendations, then we're back to pre-1986, and anybody can file a claim against a vaccine manufacturer, say it caused their autism, or say they got a vaccine and then 6 weeks later they had a heart attack, and that they're going to have to go to court and defend against that. And then who knows what's going to happen to the availability of that vaccine or the price of that vaccine in the United States. And one thing I did want to say about this very complicated topic is that vaccines are not liability free. You know, there is a law firm right now that RFK has a vested financial interest in the outcome of a Gardasil vaccine, which is the HPV, cervical cancer, head, neck, esophageal cancer vaccine. And RFK, and that's in federal court, and RFK has a financial interest in that. So when he says that, you know, there's no way to sue vaccine manufacturers, that is just a lie. It's a lie.
Mhm. Yeah, one of the things I'd like to sort of jump to where, sort of tailing on that subject is the apparent suspicion. And, believe me, I am not going to jump in and defend Big Pharma, but there is a huge amount of suspicion that RFK Jr. is casting upon the pharmaceutical companies. And and I think that that sort of weaves in with what you were just talking about, Ashley. So he is casting Big Pharma as the big villain, that the only reason that they're developing vaccines and promoting them is because they want to make a lot of money. So, can
Can
you
I
speak
jump
to
in
that?
for just a second?
Yeah, please.
He makes millions and millions of dollars on unregulated, untested supplements, and no one's talking about the supplement industry. And the supplement industry is like in the trillions as far as what people are making in supplements. And Ashley, you would need to step in here, but there has been some lobbying and legal issues where supplements do not have to be tested. They
Well,
do not have to be tested
supplements are
for,
not regulated by the
they're not,
FDA.
yeah, they're not regulated, they're
So
not
there's
tested.
there's been studies where they, a colleague of mine looked at some of these supplements and they contain products that they didn't list on the ingredients. And some of them could potentially be very dangerous, like ephedrine, for
Or
example.
some have lead in them. They
And
found
so, I
lead
mean,
in
yeah,
them.
they're terrible. I mean, yeah, and it is a huge market. You know, people think it's much safer to take 5 supplement tablets with dinner than it is to get a vaccine, and it's, you know, somewhat ridiculous. And again, I go back to I actually worked you know, for a pharmaceutical company before I went back and earned my PhD, and I have a spouse that still does. And I wish we made the kind of money that a lot of people seems to think that we do. You know, I'd be driving a much fancier car. But you know, I don't think people understand too of how much money it takes to do a lot of these clinical trials that are done. And also, again, there's no benefit in making a medicine that you only have to take once or twice that then teaches your body how to prevent a disease. The money is going to be if you can create a medication that is a more effective way to treat cancer or Alzheimer's disease or something, you know, of that nature. Your market is just going to be so much bigger. You know, look at how much, you know, if you recall when you know, a quote unquote cure or medication came out to get rid of hepatitis C. You know, the initial cost of that was and was, I don't know, $30,000 a dose. And we still have medications like that. Skyrizi, for example, is, you know, well over $30,000 a dose. So, you know, vaccines are actually not a great way for a pharmaceutical company to make a large profit and sustain that business model and those profits.
Yeah, I was fascinated when I was talking to Ashley before this, before when we were prepping about sort of the concept of big pharma versus big wellness. So, Ashley, can you speak to that a little bit? Because it blew my mind, frankly.
Yeah, it's so funny. And, you know, it's anytime anybody now stands up for vaccines, you are a pharma shill, right? You couldn't possibly think that vaccines are good for you. And the only reason you must be vaccinating your kids is because you're a pharma shill. I mean, that's the trolling that happens. But all these people that are saying that are also selling supplements on their Instagram and saying, use my referral code for 20% off. So it's really this like big wellness sort of in cahoots with each other about if we demonize the other and say, let's all go back to a more natural life, it sounds better. And sure, I think a product that labels itself natural versus a product that doesn't call itself natural sounds better. But when you look into it, there's nothing. The natural label is meaningless. It's something that this big wellness came up with. And so just to anybody out there who is, I mean, I'm an advocate. I do advocacy, so I focus on really building people up to become advocates in whatever form that will take. But for those people that are out there and having those difficult conversations, and if you are being labeled as a pharma shill, um, just think of it as like my elementary school kid who, when I best him in an argument, he just calls me a butthead. Because he knows what I'm saying is right, but he has no comeback except to just call me a butthead. So when people are calling you a pharma shill, they know that you're right. They know the science is behind you, but you know, they have nothing else to say except for that you're a butthead.
Mhm. Yeah, I happened to listen to a clip with um, Neil deGrasse Tyson yesterday, and the way he was putting it was, back 250 years ago, our lifespan was 30 years, and by 100 years later, it was 35 years. And now look at, and all of that time, everything you ate was organic. There were no chemicals, no pesticides. The air was pure, the water was clean. Well, maybe it was a little further ago than that. And now look at our lifespan. What do you attribute that to? It is definitely not organic foods. Um, so anyway, that I just threw that in. But uh, one of the points I want to sort of returning to HHS and ASIP, I just want to make sure that we're drilling home the fact that if any vaccines are removed from their recommendation list, we run up against the possibility that insurance may not cover them because insurance companies have been looking to ASIP to make the recommendations. And I have also seen that some medical organizations are forming their own recommendations as sort of an alternative to that. So, can one of you speak to that possibly?
So I think one of the things that states can do and that people can advocate for, and this was done in Colorado, the Colorado Department of Public Health had sort of the foresight to say, we kind of are predicting what might come down the road is that some of these vaccines might be removed from the CDC immunization schedule. And so they put in place that not only are they going to take into account the CDC recommendation, but they're going to take into account the American Academy of Family Practice recommendations, ACOG, AAP. So these other organizations of physicians, they're also going to take into account what their recommendations are. And so I think in terms of advocacy at a state level, that's a really good position for states to advocate for, is that your state's not only basing what vaccines their Medicaid and health exchanges are going to pay for based upon CDC, but also upon these other reputable groups.
Yeah, there
Well,
was a question in the chat about where to look besides the CDC. So with my medical students, I did capture and keep the 2025 immunization records that were on the CDC before all the craziness was starting to happen. So I have that in the archives, but I go to immunize.org. Immunize.org has all of the vaccine information sheets and immunization schedules. It's a wonderful site for, frequently asked questions. They've been archiving things and putting things up for a long time. You can also go to the American Academy of Pediatrics, American Family Physicians, the AFP, and there's also ACOG, which is something.
College of obstetricians and gynecologists. Yeah.
Yeah. So between those four, yes, and then also Brandy in the CHOP, there's a CHOP so Children's Hospital of Philadelphia CHOP Vaccine Education Center. They also have great stuff. But if you had to just pick one, I would go immunize.org because I think they compile everybody's stuff and put it there.
Great. Now, we have about a little over 10 more minutes, and I'm wondering if there are other areas of sort of this big picture, all of these sort of interlocking pieces that go together for in terms of the vaccine testing recommendations, etc. Um, if there are any other subjects you want to sort of bring in, and then I want to spend a few minutes on Arizona specifically. So, and Pete, yes, you can ask questions, just drop it in the chat, and we're catching some of those as we go. So Ashley, is there anything that you wanted to cover?
One thing I wanted Amy and Stephanie to address before we go on is there's a big misconception about theirs. So I wanted Amy and Stephanie to explain like what theirs is and why that is not a reliable source. So just for any of our audience members, what it is, because they might hear about vaccine injuries, and I think it's important for them to know, like, just a quick overview of theirs and what safety monitoring systems we have.
Sure. So I'll start and then I'll pass to Stephanie because she can fill in all the holes. So VAERS is the Vaccine Adverse Event Reporting System. So Vaccine Adverse Event Reporting System. And it's a great system because the CDC and the FDA will gather reports that people will file if they think that there was an adverse event after a vaccine. So that's a great way of seeing if, what type of adverse events pop up. On the flip side, just like how anyone can write a blog these days, anyone can put anything in VAERS. So I could get a vaccine and I could tell you that that night I stubbed my toe, and I could put that in the adverse events reports, or that I got scratched by my cat, or all these different things. So some things, and I'm not trying to make light of things that are actually real, because real adverse events do happen, right? Just like anything. But a lot of people know that you can put anything there, and I think that sometimes there are people that go in and use it for nefarious purposes. And I think that sometimes the system is abused and used inappropriately. But I still think either way, it's a great tool in theory to have for people to write down things that they think are legitimately, because that data is combed through. And if something pops out, it's then looked at and analyzed. And vaccines have been called into question, and in some cases removed based on things like that. So it's very important. So Stephanie, I know you know more than I do, so I'll pass it to you.
Well, I don't think so. I don't know about that. But I would agree. I mean, I love VAERS as a tool if it was used appropriately to really track, vaccine safety and monitoring. We always want to be tracking the safety and monitoring of not only vaccines, but all medications that are administered and dispensed. VAERS does have its problem in that it is self-reporting. And so, for example, I had a person that was administered a vaccine inappropriately, and they accidentally put it into their shoulder joint. I'm not exactly sure how they did that, but they did. So ended up in the bursa of their shoulder joint, and they had to go in and have bursa removed because it caused problems. That had to go through VAERS, which is it's an inappropriate place to put that. But it looks like it's another adverse event due to vaccines, and it was really due to improper vaccine administration. So that's definitely a concern. And there's also, other systems that are used to monitor, vaccine safety in addition to VAERS that we really don't talk about much. There's vSafe, which is one. There's also the Clinical Immunization Safety Assessment Project. And that also consults with healthcare providers. So we have a few different ways in which we monitor vaccines. And I would say in terms of vaccines and clinical trials, we also call what we call a phase 5. Clinical trials usually have 4 phases, a safety and monitoring and a dose escalation, and then, some pivotal large scale trials. And they also have what's called this 5th phase, where The vaccine might be licensed and is being administered, but they're still collecting safety data on it to really capture as much data as they can about the safety of that product. And so, those are some other ways that we're also tracking vaccine safety and efficacy too.
Mhm. Great. Now, I would like to bring it to Arizona specifically. And Ashley, since you're here, what can you tell us about the culture surrounding vaccination and vaccines here in Arizona, school immunization policies, things like that?
Yeah, so, I don't think this is going to surprise many people like myself who live here in Arizona, but we are living in a hyper polarized political situation here in Arizona. What used to be a very bipartisan issue decades ago has now become a super polarized ones. It used to be vaccines were just like non-issue, right? Like you would just get your vaccines like you got your blood pressure checked. It's different now. And in Arizona specifically, we have been consistent in that we have elected specific lawmakers whose mission and whose platform it is to bring truth to the Arizonans about vaccines and the dangers of vaccines. And I obviously say that tongue in cheek. So these individuals have, for whatever reason, been given a platform by some leaders in our Arizona legislature year after year to have their bills introduced and have them be heard in committees instead of deciding that it shouldn't be priority and it shouldn't take up precious taxpayer time and taxpayer dollars when we're paying these elected officials to do a job to protect us all. Um, and, I view our job at Arizona Families for Vaccines as to drum up that ground support for pro-vaccine policy. Uh, Not just in Arizona, but across the country, anti-vaccine activists, they are not the majority. Across the country, people who vaccinate their kids and themselves are super majority. Yet, everybody who lawmakers are hearing from on this issue are anti-vaccine advocates. Uh, People who vaccinate themselves and their kids, like myself, I, before I took this job, I just vaccinated my kids and myself, and I moved on with my life. Right? I didn't feel the need to publicize it. I didn't feel the need to convince anybody else to do the right thing for themselves or their kiddos. But in contrast, people who think vaccines are unsafe are doing that. It's not enough that they don't vaccinate their kids. A lot of them want policies that decrease vaccination. They want policies um, that emphasize that vaccines can cause injuries. And they really are politically connected and politically active. And I think, case in point, if you look at RFK to how he got where he was, it's by the support of this really, really vocal minority. So I really think in Arizona, it's very important for us to make sure that we are drumming up that ground support and getting people to log into RTS. And CBV has a great RTS tutorial and system. So I would encourage people to do that. Arizona Families for Vaccines, we have an advocacy day at the Capitol every year. I would encourage you to do that. If you go to our website, you'll see we have a personal story. We're trying to create a storybook about people who live in Arizona who either have a experience with a vaccine preventable disease or have a condition, or someone in their family has a condition, why it's so important that you want herd immunity to be maintained and increased. So those are some tools that you can use just by going to our website. This fall, I am planning a vaccine roadshow to go around the state and connect with people and their lawmakers in that districts. So I know there's a very active chat here, and Kathy and CBV will put my email in there. So I would encourage you, if you're interested in this and you would be willing to talk to the lawmaker in your district, email me and we'll set it up. It's really important for them to hear from their constituents on this issue because we just haven't done a good job of pushing them on this issue.
Mhm. Yeah, absolutely. And as Sundrop is mentioning in the chat, we do a follow-up email to all of our events. It will include all of the links that we've been dropping in the chat, probably a few that we have maybe missed, but we'll follow up with those links. And Ashley has also done an amazing job of creating a couple of toolkits. As those of you who follow CEBV know, we always leave you with actions that you can take. So we have compiled, and Ashley has done an amazing job of compiling resources and places for you to look for more information and a sample email to your lawmakers or letter to the editor. And CEBV also has a letters to the editor hub that is in the toolkit. So all kinds of resources there. There's one toolkit for federal policies and one for Arizona policies that we will continue to build out. So we always leave you with things to do, and I'm wondering if before we close out, if each of you has some final words of hope, encouragement, and onward. Why don't we start with Amy?
Yeah, thanks for having us. I always love talking about immunology, vaccines, supporting public health. And I think I put in the chat, but if you feel overwhelmed or powerless, just even following one simple step on the toolkit is really helpful. Anything that people do, even if it feels small, also, one step at a time. You don't have to do all of the things at once. Just even, focusing on one thing at a time. I think that's really, really helpful. So it's going to take all of us just doing small steps together.
Mm-hmm. Definitely, you're singing our tune. Stephanie.
Yeah, I would say a great thing is to join the Arizona Families for Vaccines Coalition. Um, and they always will make things somewhat easy in terms of they'll format letters for you that can go to your legislators. As someone that's been on the Hill, a lot of these legislators might not really have an opinion on vaccines that much. And so if it's really important for them to hear from their constituents about the importance of immunizations from their constituents. And whether that is just, maybe make it a goal to go to one town hall a year and just say this, when they're like, any questions or whatever, you just say, this is my concern, it's good for them to hear that. And if you're not a public speaker, letters to their office or phone calls to their office, those are all recorded, and numbers matter. So the more phone calls they log in favor of a certain, vaccine bill, all of that matters. So I think that, joining the coalition is great. And I think don't be afraid to go and talk to your legislators and just say, as your constituent, here is my concern. Because they want to get reelected usually. And so they will often pay attention to what the majority of their constituents are saying.
Mm-hmm. Yes, indeed. Well, come to Arizona and you will you'll be able to hear about our lawmakers. Ashley, any final words?
One, none of you are buttheads. I know all of you are very smart people on this call. And the only lasting thing that I have to say is thank you guys for coming and just being willing to listen. And I know that in comparison to some other topics, talking to a lawmaker about vaccines can seem daunting because, you know, you might not be a physician, you might not be a nurse, or you I'm neither of those things. The only thing I knew about vaccines before I took this job was what my pediatrician told me. And now I feel empowered enough that I can go and I can speak to a lawmaker because a lot of them don't have the bare minimum. A lot of them are equal or maybe less knowledgeable on the topic that you are, but we can get you there and we can work with you to a place of that you will feel comfortable talking or taking action on this issue however you want to. But I just want to underscore that it is very important that we all do this because we got to this place that we're at now by not being vocal enough about it, by just vaccinating and moving on, and it's not enough anymore.
That is a perfect way to leave. I think that we're always talking about how they hear from the few and the loud. And sort of the many and the quiet do not always speak out. So it is so incredibly important for us to do that. So I think I'm going to close us out now. I appreciate everybody for joining. Again, you'll get a follow-up email. We will post this recording on our YouTube channel and you will all get links. Please, please spread the word, spread it to other people. I think this has been a very valuable conversation. And I appreciate Amy, Stephanie, and Ashley. I appreciate everything that you do. And I'm so happy you were able to join us this evening.
Thank
Thanks
you.
again.
Thank you.
Okay. Good night, everyone.
Night.